I'm Dr. Rajesh Goel. I'm a senior consultant for a nephrologist in PSRI Hospital, New Delhi. So today I'll be speaking about the topic on chronic kidney disease and how to delay the progression of chronic kidney disease. First of all, I want to mention about what is chronic kidney disease. Chronic kidney disease is an irreversible kidney failure or reduction in the glomerular filtration rate. That means it's a permanent chronic kidney problem, or there is the kidney failure, or it, kidney disease cannot be reversed back to the normal functioning state. So we call it persistent for more than 3 months of reduction in the GFR less than 60 ml per minute per meter square, body surface meter square, for at least 3 months, then we call it as a chronic kidney disease. So first of all, we should be aware that what is difference between the other types of kidney disease or chronic kidney, other types of kidney failure. If there is an acute kidney injury or acute kidney failure, most of the time it gets reversed. The failure, the reduced GFR or the high creatinine value will get reversed back to normal functioning of kidney function. Or sometimes, if the rapidly progressive renal failure is there, that means the renal failure or kidney failure is in days to weeks, what we call as rapidly progressive renal failure. In those cases, also, if we treat at an timely, then we can reverse the kidney problem. So, what are the high risk of developing a chronic kidney disease? The most common risk factor or cause of kidney failure is diabetes. In adult age group of people, if we see kidney failure, then more than 50% of the patients will be having a history of diabetes, and the kidney failure is related to diabetes. Then other common disorders which lead to kidney disease are uh, kidney stones, then chronic pyelonephritis, cystic disease like autosomal polycystic kidney disease, then other genetic disorders, then glomerulonephritis like IgA nephropathy, vasculitic like lupus, and many others. These are the causes of chronic kidney disease. And the risk factors for having a chronic kidney disease are elderly age group, hypertension, diabetes, family history of kidney disease, then recurrent urine infection, and kidney stones. What are the signs and symptoms of a chronic kidney disease? In mild to moderate or even at later stage of chronic kidney disease, there are no symptoms or signs. So sometimes we pick them on routine health checkup or routine evaluation or incidental finding if the patient has gone for some other testing for other purpose. Then on routine health checkup we commonly find to have a kidney disease. The symptoms are presented in the very late stage of chronic kidney disease. The symptoms which are commonly we see, they are the patient will feel breathlessness, swelling, nausea, vomiting, low appetite, anorexic, and uneasiness, restlessness. These are the common signs, symptoms of having a chronic kidney disease. The patient will have a pallor, edema will be there, and sometimes altered mental status, encephalopathy, then pericarditis and hyperkalemia and severe metabolic acidosis are the emergency presentation of chronic kidney disease. So it is very important to pick up chronic kidney disease at an early stage when the patient is having no symptoms. Because timely, if we pick up the chronic kidney disease problem, we can obviously maintain the patient, and the patient should will be prepared, and we can also try to delay the progression of chronic kidney disease. There are five stages of chronic kidney disease. starting with CKD stage 1, in which the GFR is normal and that is more than 90 ml per minute. Then CKD stage 2, in which the GFR is between 60 to 90. Then CKD stage 3 is divided into two parts from 45 to 59, then 30 to 44. Then CKD stage 4 is when the GFR is between 15 to 29. Then CKD stage 5 is when the GFR is less than 15 ml per minute. Then when the patient is on dialysis, we call it CKD stage 5D. And when the patient has undergone a kidney transplant, we call it CKD stage 5 transplanted patient, CKD stage 5T. Then uh, mostly the biochemical parameters are also starts abnormal or high creatinine. We found it in CKD stage 3 or onwards, more than CKD stage 3 or onwards. So initial 1 and 2 CKD, there are the even the biochemical parameters are normal. Then at later stages of CKD stage 4 and 5, we find low hemoglobin, low bicarb with what we call as metabolic acidosis, and high potassium at a later stage of CKD stage 5, low calcium, and high phosphorus values. Then some other findings we see in biochemical parameters are high parathyroid hormone, low vitamin D, and others. So according to the symptoms and biochemical parameters, we treat a patient with for low hemoglobin, we manage with oral or IV intravenous iron therapy, erythropoietin therapy, or darbepoetin therapy for hemoglobin. Then for calcium phosphorus by calcium supplements and phosphate binders in vitamin D therapy. For acidosis for low bicarb, we give it soda bicarb therapy. For high blood pressure, most of our patients are having high blood pressure, managed with antihypertensives. Then for if diabetes is there, better to manage with insulin therapy. Oral hypoglycemic therapies are difficult to balance or control sugars. Then the most next important part of the CKD management is how to delay the progression of CKD. Then we should avoid any nephrotoxic agents like contrast, common painkillers, some antibiotics, certain medications, excessive diuretic therapy. Then control of blood pressure, better to maintain less than 140 by 90 millimeter of mercury. In case of proteinuric kidney disease, better to maintain blood pressure less than 135 by 85. Then uh, here, by controlling the blood pressure, the common therapies are ascimiters and ARBs. With the use of ascimiters and ARBs, um, the risk of having high potassium level is very important to be concerned. So the patient should be on proper follow for high potassium values when the patient is on ascimiters and ARBs. Then the next is newer therapy for Finrenone. Finrenone is also a very important therapy to delay the progression of CKD. It is a newer drug which has come up for delay the progression of CKD, Finrenone, and the dose is 10 or 20 milligram once daily. It has been come in the recent guidelines and very important drug to control the rapid progression of CKD. And also the SGLT2 inhibitors, dapagliflozin, is also a very important drug. Even if the patient is having proteinuria with diabetes or with no diabetes, the use of 5 milligram or 10 milligram once daily dose is also very important drug for the delay of the progression of CKD. Then in case of diabetes, control of sugars less than HbA glucose related hemoglobin should be less than 7%. Then avoid any form of nicotine use, tobacco use or smoking. It also is very important, which will cause rapid progression of CKD. Then sometimes uh, in kidney stone patients, they will tends to have a urine infection or pyelonephritis. So timely management of obstructive uropathy or stone management, kidney stone management is also very important, which will cause acute or chronic kidney disease. So they also have a high risk for having a pyelonephritis, repeated urine infection, or obstructive uropathy. These are very important to manage chronic kidney disease patients. Then once the GFR falls below 15 in the CKD stage 5, should prepare a patient we should counsel and prepare the patient for renal replacement therapy. The renal replacement therapy in form of dialysis, it could be hemodialysis or peritoneal dialysis, or directly to go for a preemptive kidney transplant. So what is the time when to start a dialytic therapy or renal replacement therapy? The best way to go for directly for a preemptive kidney transplant when the GFR is less than 10 or near to go for dialysis and patient is having uremic symptoms, then the patient can go for directly for preemptive kidney transplant. Otherwise, fistula to be made before. Fistula should be prepared well before initiation of dialysis, or if the patient is opting for peritoneal dialysis, then peritoneal dialysis catheter should be placed few months before when to decide to start renal replacement therapy or dialysis. So that's it for chronic kidney disease management. So finally, it's a very difficult to handle because ultimately the chronic kidney disease will progress to finally to stage 5 and requiring a renal replacement therapy. So there is no specific or any drug which will maintain the creatinine value at that stage only, as CKDs will definitely will progress to end stage renal disease or stage 5. So the important points are the patient should be well prepared enough. Counseling should be done to the patient and the relatives for renal replacement therapy or preemptive kidney transplant. That's it for chronic to my lecture. Thank you.